Today, we're diving into a really clever piece of surgical innovation. For patients who need breast reconstruction, surgeons have developed a technique that takes a super complex procedure and makes it simpler, safer, and faster. It's called the propeller flap, and trust me, it's a total game changer.
Okay, so here's how we're going to break it down. First, we'll get into the big challenge that surgeons were up against. Then, we'll look at this elegant propeller flap solution. After that, we'll walk through the actual surgical blueprint step by step. We'll see how it performed in a clinical study. And finally, we'll wrap up with why this is such a leap forward.
So to really get why this is such a big deal, we have to go back to the beginning. Why did surgeons even need a new trick up their sleeve? Well, it all comes down to the problems with the way things used to be done.
This slide just lays it all out, doesn't it? The before and after. On the left, the old way, the traditional flap, was just a beast. It was complicated, it took a long time, and the big villain in this story is that last point. You had to dissect deep into the back muscle.
And that's really the heart of the problem. Surgeons wanted to use the patient's own tissue from their back, which is fantastic for getting a natural-looking result. But to do that, they had to spend hours meticulously, carefully teasing out the tiny artery and vein that kept that tissue alive. Those vessels were buried deep inside a major muscle, making the whole procedure much more invasive and much longer.
So, how do you solve a problem like that? Well, the answer wasn't more complicated surgery or some fancy new device. It was, believe it or not, about simple geometry, an elegant rotation.
Here's the big idea right here. I love this term, an island of skin and fat. Instead of freeing up a long leash of blood vessels, surgeons create this self-contained block of tissue. And the key is that it stays connected to its lifeline by just one single point, a perforator vessel. That's the artery and vein pair that nourishes the entire island. And this is the magic trick. The name says it all. That island of tissue just rotates. It pivots 180 degrees on that one little blood vessel, just like a propeller spinning on its hub. This simple, brilliant swivel is what completely eliminates the need for all that difficult, deep dissection into the muscle. It's genius.
Okay, that's the theory. But how does this elegant idea actually play out in the operating room? Let's walk through the blueprint, because the level of precision here is really something to see.
So everything starts with meticulous planning, way before the first incision. First, and this is pretty cool, the patient actually stands up and flexes their back muscles. This allows the surgeon to literally see and feel the edge of that big latissimus dorsi muscle and draw right on it. Then they find the blood supply. Using anatomical landmarks, they measure and mark a very specific spot, usually about 8 centimeters below the armpit. That's the sweet spot where that vital perforator artery is almost always found. Finally, with those key points mapped out, they draw the shape of the flap on the skin, often designing it on an upward angle to get the most tissue possible for the reconstruction.
All right, now we're in the OR. The surgeon begins to carefully lift that island of tissue, working from the outside in and staying just on top of the muscle's protective layer. Then comes the most critical moment. Using high-powered surgical loops or a microscope, they zoom in and carefully identify those tiny but essential perforator vessels. Now, how do they know if the blood supply is good? They use a simple, real-time check. They look for healthy, bright red bleeding from the very tip of the flap. That's the tissue itself giving the green light. Once they've confirmed a healthy blood supply, they release the tissue around that vessel just enough so it's free to make that 180-degree propeller spin into its new home.
So, it's a brilliant technique on paper, right? But the real question is always, how does it hold up with actual patients? Let's take a look at the data from the study. The study we're drawing from looked back at the outcomes of 16 different patients who had this exact propeller flap procedure for their breast reconstruction between 2009 and 2013.
And the results? Honestly, they are incredibly strong. The headline number, a 100% flap survival rate. Every single one worked. There was zero, absolutely zero major complications. Out of the 16 cases, there were just 4 minor issues. 2 cases where a tiny bit of tissue at the very tip didn't survive, and 2 cases of minor wound separation. And all of them healed just fine on their own without needing another operation.
And numbers are one thing, but this is where it really hits home. Take this case, a 68-year-old woman whose reconstruction with an implant was failing because of previous radiation treatment. This wasn't a straightforward case. This was a rescue mission. The propeller flap allowed the surgeons to bring in fresh, healthy, well-nourished tissue to fix the problem, and the outcome was excellent. It shows just how versatile this technique can be.
So, let's pull all this together. After looking at the technique, the planning, and the results, what's the bottom line here?
What does this really mean for breast reconstruction?
The advantages are just so clear. It's simpler and it's faster. Because you're not cutting into that big back muscle, patients have less pain and fewer long-term problems. The scar can often be hidden nicely under the arm or along the bra line. And, most critically, the function of that big back muscle is totally preserved, which is huge for a patient's strength and quality of life. The bottom line is, this has been proven to be a safe and really effective option.
And hey, you don't have to take my word for it. The study's own authors put it perfectly. They said this isn't just some minor tweak on an old idea. This is a true alternative, a genuinely different and in many ways better option for both surgeons and their patients.
And that really leaves us with something to think about. Whenever a complex surgery gets simpler, faster, and safer without giving up great results, it opens the door for more patients to benefit. It really makes you wonder, how will this kind of elegant, clever thinking continue to improve surgery for people all over the world?